We're now going to our final speaker, Frances Knight, who's done an amazing little bit of research on processes for successful uptake of nutrition modelling tools. This has only just come out, and Frances has very kindly agreed to talk to us at very short notice. We're really looking forward to hearing about what it is that makes for a successful tool. Over to you, Frances.
Thank you so much, Julie. Please let me know if you can't see my slides or can't hear me. So hello, everyone. Thank you for staying online, and it's lovely to be speaking today. And firstly, I'd really like to say congratulations to everyone who was involved in developing and testing this tool. It's just fantastic to see, and as somebody who's been taking a very close look into different nutrition modeling tools, it's wonderful to see the process that you have used as well, the amount of people you've involved, and this real focus on having a user-friendly, applicable tool. So I really congratulate everybody. My name is Frances Knight. I'm a PhD student at the London School of Hygiene and Tropical Medicine, part-time. The rest of my time I'm based at the World Food Programme in Rome in nutrition. I'm also a mother of twins who are still being breastfed, and they're 13 months old. So this is especially exciting to me to be part of this. I first wanted to introduce everybody to the Nutrition Modelers Consortium. Nutrition modelling tools might be a bit new to many people on this group. So just to let you know, there is a consortium of people out there who have developed many different nutrition modelling tools. Some of them model the cost and affordability of nutritious diet. Some of them estimate the cost of malnutrition burdens. Some of them, like the cost of not breastfeeding tool, estimate the cost of not breastfeeding. Others are used for specific decision making around what interventions might be most cost effective or what to do about malnutrition. In around 2017, a lot of these tool developers came together because we saw the common, I guess, benefits that we could have of working together to improve how our tools spoke to each other, the technical aspects, but also look at the usability and the processes that encourage uptake and use of the results of these tools. One of the issues that we all identified is that even though there have been a lot of results and methods and mathematical modeling of these individual tools published out there in the literature, there was very little published on their actual impact, how the results were then taken to impact policy or policy making decisions in some way. So we wanted to do something about that so that we could make more of a, I guess, argument for funding these tools and for applying them, so that we could make more of an argument for people to start using them in different countries, specifically low and middle income countries, but also to inform how we use these tools in the future. So that's where this research project came about that was done over the last couple of years. The main objectives were to document different modelling tool analyses or applications, including the objectives, the analysis, how it happened, and how the results were disseminated, but also then to document any use of the results and what influence that might have had on program or policy decisions. We also wanted to identify factors that strengthen or hinder the program or policy influence of these tools so that we could develop some sort of recommendations on the design and implementation of these tools and how we use them in the future, essentially. So not just the tools that we looked at, but also other tools going forward, such as the mother's milk tool. Very, very briefly, we used semi-structured interviews with tool users. I'm not going to go too much into the methods, but just so you know, there were 14 different tools that we included. These are some of them. You can look at all of the details in the paper. We had 32 individual case studies across Asia, Latin America, and Africa. There's some sort of breakdown there with the size of the boxes in terms of how many case studies. We spoke to people from academia, governments in these countries, UN organizations and NGOs, and we split tool users into 3 different categories: brokers who set up or asked for a tool or funded a tool to be used, the analysts, and then the consumers, the people that were actually being targeted with the outputs of the tools. So I'm going to really briefly recap the findings because we don't have a lot of time. But I think the main thing is that we found that the tool applications contributed to enabling environments for nutrition and nutrition policy change, and they did influence programs and policy in most cases. Going down into the specifics and breaking up these influences by the policy cycle stage where the tools were used. In terms of advocacy, we found that tools increased nutrition commitments, validated existing policies, and contributed to advocacy efforts. When used for situation assessment, the tools were really useful for addressing misconceptions around why malnutrition existed or what sort of solutions were needed, or improving understanding about the situation by policymakers. The tools really helped specific issues to gain momentum or be targeted in programming, such as adolescent nutrition or the need for fortification or breastfeeding, for example. And then more specifically, when used for program planning, the tools are really important in prioritizing particular interventions or particular responses to these problems over others. So being able to select the most effective or cost-effective or appropriate for a particular context. And then lastly, the tools are really useful in informing program scale up or justifying improvements or more funding for individual programs. So really helping to make a case and show what was needed. But importantly, it's really necessary to point out that the tools themselves were never the only reason that a policy change or some sort of program uptake happened. And there was also a lot of potential that we found for strengthening their influence. So a couple of things we learned then around factors that influenced the modelling tool applications and how they were used then to inform policy and program decision making. As I said, this is a very quick overview. These were some of the main things that we found. The reputation and acceptance of the modelling tool itself and the institution using it. If it was a well-known university or a well-known agency that was coming in with the tool, or the tool had been used in 20 other countries in the region, policymakers, health, technical people were much more likely to pay attention and then to use the results themselves. They needed to build that trust. That leads me to ownership. If people such as local technical nutrition staff or technical health staff and then their bosses and then the policy bosses above those felt that the analysis was theirs, that they had been involved as opposed to something just being presented to them, they were more likely to use it themselves and also then to keep relaying it up that chain to different policymakers. That also feeds into local capacity. In certain contexts, it was possible to train up different groups of people to use the modelling tools. Now, we're talking about very diverse tools, some of them as simple as the tool that you've seen today, and some of them involving 2 weeks training. So this is a very broad result, but it really did help where local people could be built, sort of their capacity could be built to use these tools and to even at least understand the results, even if they didn't do the analysis themselves. That was much harder when there was a lot of perceived complexity or actual complexity of the methods and their results. As we've seen, so many people today commented that because they could use the tool themselves to calculate how much their breast milk was worth, they see that it's easy and it's easy to use and they know what they're saying when they talk about the results. So that was a very big, important challenge. Also, we found that where tools could be based on secondary data, such as national DHS, HCS datasets that belonged to governments, had been validated and were nationally representative, there was much more uptake because people trusted the numbers coming out because they trusted the numbers that were going into the analysis. So that transparency and using data that validated even work that other people had done was very important. Then also timing the analysis and having it at a time, targeting at particular policy issues, particular policymakers was important. But on the other hand, it was also important to be able to keep using the results at different times when sort of serendipitous opportunities for embedding these results in policy discussions happened. Now, both of these required capacity, and this was a big, I think, missing area that we found. It's one thing training people to do an analysis, but if the people that you train or the people that are there and you expect to use the results don't have that strong capacity for translating evidence into program design or for advocating based on this evidence, it's not going to go anywhere. You just have results sitting in a folder or in a report. So this was really important. And that also then required resources. It wasn't enough just to say we're working with the local health monitoring team, we're working with the government nutrition department. If they don't have enough staff, if they're not being recompensed for their time, if they don't have the funding to come to all of the meetings, to go to a 2-week training, then it's really unfair to put this extra pressure on them. So resourcing the people that you expect to work on this analysis as well. And then lastly, a challenge that was always going to be there if the political system changed, if staff changed, that engagement was changed. So, often tools or groups using the tools had to restart completely to make sure that there was that strong engagement. So wrapping that up, some really key recommendations or findings coming out of this. is that the policy influence is not the result of an individual tool alone. It's not just numbers, it's how the tool is embedded in strategic, larger advocacy efforts. So you can't just come out with great numbers and expect everything to change around it, as I think most people on this call have said. You really need to couple it with activities to build understanding and ownership of the results among the people that you hope that will use the results to bring about policy change or inform discussions. Accessible tool interfaces like the Mother's Milk tool are really encouraged. However, what was even more important, it was high quality, simple and relevant communication of methods and findings to people who won't be using the tool. And I absolutely loved the policy brief that can come out of the Mother's Milk tool. That's exactly what we're talking about here. And it's so great to see that come in at this early stage. And we only encourage other tool users to do something similar. In a similar thread, capacity building to do the analysis might be really appropriate and requested by local partners in some contexts. And in those contexts, we would encourage it. But in other contexts, it might even be more important just to focus on advocacy capacity first, ability to use the numbers that come out of these tools and make sure that they're applied. As I said before, using secondary data really helps with ownership and trust of the results. And then in many cases, people coached local partners to present the modelling results themselves. So instead of having somebody from the international organisation or university fly in and present, building up and coaching the local partners, working over the presentations 10 times together so they present it to their peers had a big impact. As I said before, really then also making sure that local partners have the resources to be involved meaningfully in these endeavours. So if there's funding needed, if they need to have a person seconded to their organisation to help out with this, those sorts of things are really important to consider. If you're interested in reading the paper, there are many, many more findings, quotes and details about all of these tools. I've included a photo for this particular audience because I actually wrote the paper whilst breastfeeding my twins exclusively. So it's always going to have a very special place in my heart. We really, if there's any questions that you have about the paper, if you would like to know more about the Nutrition Modelers Consortium as well, please feel free to contact me or contact us if you just Google the Nutrition Modelers Consortium. Thank you so much for your time.
Thank you, Frances. What a superb way to end the webinar. Very insightful. The tool stacks up pretty well. I'm now going to hand over to Roger. Q&A dealt with very quickly because we're going to use the chat to develop frequently asked questions document. So I'll hand over now to the Alive and Thrive team. So thank you to our fabulous speakers and testers, and over to you, Roger or Duan, Alive and Thrive.